A very good evening, everyone. It's just amazing to see the enthusiastic crowd joining us. We will be beginning in just a moment. Before that, before we start the session, please I request everyone to quickly mark your attendance using the link that I have shared in the chat box. This is your attendance link. Kindly fill it. It'll just take few minutes, few seconds, I believe, for you to go ahead and fill this entire form. Please fill the correct information here. Thank you so much. We're starting in just 2-3 minutes. Meanwhile, you all can start filling your attendance form. Stay with us. We're going to just start the session. Today's session promises perspectives that are both insightful and future relevant. So before that, please go ahead and fill the attendance link. I'm sharing the attendance link again. Do not worry. And throughout the class, in first 15 to 20 minutes, I'll keep sharing the attendance link for you. If you do not find it, you can find it again. But for now, if you just see it, please make sure you fill it. I hope you all can see the attendance link. You have to fill your registration number along with your name, the correct registration number and your name. Please make sure the registration number is correctly mentioned. And we are starting shortly. So meanwhile, since we are waiting for all other users to join in, I have a question for you all. How many of you have ever used a health application? Any step tracker, any diet application, or maybe we all have these meditation applications also. Platforms are there. So if you have used any, you can drop it in the chat box. What applications you have used for your health? You can drop it in the chat box. We're waiting for your response. Again, repeating, how many of you are using any sort of health application, any health tracker? Your registration number here is what I can see in the chat box. Your registration number is your unique identification number that you've got. So you have to fill that. So I'm getting the responses. Our speedometer is there. Okay, good. Step counter. You can name the application also. Amazing. Sounds good. So you people are aware of what health trackers we can use, and you're using it because we all are becoming health conscious these days. So with this, we'll be starting with the session. And before we formally begin, it is my great honor to acknowledge the visionary leadership that guides every initiative under the Center for Distance and Online Education. We take great pride in recognizing the distinguished leadership of Honorable Chancellor and Member of Parliament, Dr. Ashok Kumar Mittal, Lovely Professional University, worthy Pro-Chancellor, Colonel Dr. Rashmi Mittal, Lovely Professional University, respected Vice-Chancellor, Dr. Jaspal Singh Sandhu, Lovely Professional University, respected Director, Dr. Pavitra Prakash Singh, Center for Distance and Online Education, respected Head of the Wing, Dr. Gini Nijhavan, Center for Distance and Online Education, respected Head of the Division, Mr. Manish, Center for Distance and Online Education. Though they may not be present in the session, their continuous support, commitment, and belief in providing quality education drive every masterclass, every special class, and learning opportunity at CDO. Can we have a virtual round of applause for them once? So let me begin with a thought by Peter Drucker. It says, what gets measured gets managed. And today, in the world of healthcare, what gets digitally tracked and understood has the power to transform lives. Healthcare today is undergoing a profound transformation, one that extends far beyond traditional clinical boundaries. The convergence of technology with healthcare systems has redefined how care is accessed, delivered, and experienced. So today's class brings into focus two deeply interconnected themes: digital health and behavioral change. While digital innovation is enabling smarter and more efficient healthcare systems, it is ultimately human behavior that determines how effectively these solutions create meaningful impacts. It is now my privilege to introduce a distinguished academic and thought leader in this domain, Dr. Swapnarag Swain, Associate Professor and Chairperson, Masters of Business Administration in Hospital and Healthcare Management at IIM Bodh, Gaya. Dr. Swain brings with him a rich blend of academic depth and practical insight in the areas of healthcare management, digital health ecosystems, and public health systems. Through his research, teaching, and expert engagements, he has been instrumental in guiding learners and professionals to navigate the evolving dynamics of healthcare in a technology-driven world. That once again calls for a virtual round of applause for our resource person today. Sir, we are truly honored to have you with us today. And now I invite you to take us through this engaging session on digital health and behavioral change. The screen is all yours, sir.
Okay, thank you so much. Thanks for the nice setting up the session. It's specifically, normally we say, being one of my areas of expertise is services marketing. We normally talk about when we are going through any service. I'm also for the first time, I'm getting associated with LPU CDOE. And given that, if you talk about my expectations and the perception gap that normally we talk about in any kind of services, I did not expect this kind of energetic start of this session. So it was beyond my expectations. So that's why all thumbs up to you for making this P minus E to be on a positive side, for making this really, really interesting in the first 5 minutes. Thanks a lot. Karishma, I guess, right?
Right, Karishma. Thank you
Yeah.
so much.
Super, super. So I hope that I will be also getting the voices of my participants while I'm talking, when I will be asking questions, or how it will work.
So probably they'll be responding in the chat box only.
Oh, they will not be able to say anything. Is it
No, sir. The
visible?
instructions that you. No, sir. Yes, sir. So
It's
it will be
only
just the
through
chat box
chats.
that will work. Right, sir.
It's only through chat. Okay, fine. And if possible, can we create in between any kind of that breakout room?
We can do that, sir. That is manageable.
We can do that. Okay, fine. So very good evening, everyone. I hope I'm audible. Just give me a thumbs up if I'm audible. Yeah, very good evening. Very good evening. So as Karishma was talking about, that this session is specifically on your digital health, and specifically focusing on the behavioral challenges, or how do we shift the behavior. So before going to the session, let me ask you a few things. I would again open the chat box, though I'm not very comfortable with the chat box and all. Anyways, I have to manage with this. So first, my question is, what is digital health? Though Karishma asked you about how many of you are using any kind of health trackers, can I ask you, or you can write down in the chat box, what is digital health? Let me also understand what is your understanding about digital health. What is that? It has been a hot topic nowadays, and the healthcare is moving in that direction. So can anyone write me on the chat box, what is digital health? You can also refer to Google also, or maybe your Gemini, or maybe AI. And can you tell me what is digital health? Is anyone writing? Maybe the system we can use for tracking our health, improving all our well-being through this one. Digital health is recording your health history, able to judge what is right and wrong when we use Google and AI app. Tech plus health, okay. Digital health means record of health and planning healthy data. Anything else? Data-driven health decisions using human technology interactions. Okay, superb. Vani Vashan writes how to use any tool for positive reinforcements, then digital gadgets like smartwatch, which measures our health status on regular basis if used properly. Okay, fine, superb. Artificial intelligence for software, and not to spread awareness about negative events only. Okay, fine, great. Thanks for the inputs. So if I using technology to improve our health, absolutely, all agree. So given this, let me just introduce to you use of technology to analyze and track health issues. Okay, fine. Thank you so much for all the responses. Super active crowd. That's great. So let me share with you my screen first, and then we will enter into the topic. I hope it's visible. My screen is visible. Karishma, my screen is visible. Okay, fine. Thank you. Thank you.
Yes, sir. It's visible.
Yeah, thanks. So that's what we're talking about, digital health, the adoption challenges and inducing behavioral change. So let us first talk about what exactly this digital health is. As many of you have correctly said, it's basically a combination of the two words, that is health and another one is digital. Health is there, was there, is there, will be there. At some point of time now, digital has come into to take care of our health. If I talk about very simple language, we have been like health is always been there, and now digital technology is going to be the partner of human being to take care of the health, because it's our responsibility to take care of our health. And now digital health or digital technologies are being the partner or to take their responsibility, to share their responsibility with us. And that's what exactly we say digital health. If we talk about this, it's a theoretical definition that digital health talks about. If you look at this, it says it's a broad term that encompasses variety of terms, including e-health, m-health, health tech. Basically, what they do, they captures everything from the electronic patient records, remote monitoring, connected devices, digital therapeutics, and so on. Fine. So I'm not going to spend more time on this. It means information technology, big data, AI, machine learning, whatever we have seen that use, analyze patient data, outcome. It gives the, you can say, help the healthcare professionals to make informed decisions and improve care. That's many people have already written that. That means now, when we talk about digital health, it's revolutionizing the complete health industry. The models that we used to earlier used to deliver the care are now changing completely with respect to by using the digital health. If you just look at how many of you might have heard about this ABD and Ayushman Bharat digital mission, right? That's the biggest example of digital health. Not only that, every state government is now introducing their platforms of digital health. Like, since I'm sitting at Bihar here, I can talk about now Bihar government has started a project called as a Vabhya project, where entire dispensary, entire PHC and CHC are now digitalized, so that the patient experience is completely digitalized now. There is no record, no prescriptions which have been written on pen and paper. It's completely digitalized over there. That's an example of digital health. Or maybe you talked about apps like Healthify.me. You might have ordered some medicine on pharmacy, or you might have consulted a doctor on Practo, or maybe, for example, you might have also getting that health trackers like Samsung Health or maybe Pedometer. All these are examples of digital health. So if we talk about why this digital health is important, let's talk about the growth. See, these are very introductory things I'm talking about. It is essential, though I don't want to spend much time on this. However, these are the facts that you should be knowing. And these are available facts everywhere. So I'm not telling anything new out of this. So what is the growth of digital health in India? If you look at, again, secondary data points, few data points that I have copied from somewhere else, that's, if you look at the digital health markets, it's as per Statista. In 2024, it was a 14.5 billion US dollar. And look at the growth. It's not only double digit, it's some higher double digit, around 25% of CAGR. And it is expected to touch around $100 billion, nearly, you can say, 7-8 times in next 10 years or in next 9 years. That's the kind of growth we're talking about specifically in India. So what are the key drivers of this growth? If you look at the digital health drivers are specifically mainly on, one is government is heavily focused on this, heavily invested on this, as I was talking about. The biggest investment of government comes through this Ayushman Bharat digital missions. And you must be knowing about this Ayushman Bharat Health like IDs, ABHA IDs, basically they talk about. Ayushman Bharat Health Account, ABHA IDs have been created, and you can access to the your health records are being created, and you can access your health records at any point of time. Onboarding of your patient. So all these things are being managed. So that's the biggest, you can say, investment in India that has gone till date with respect to digitalization of the health. Public-private partnerships are there. How many of you know about this e-Sanjeevani app? Because digital health is not just about the digital health records. It's also about getting access to the proper healthcare. And why it is important? Because if you look at India as a country, though we have been talking about independence and around more than 75 years of independence, but still then, if you look at the healthcare challenges, one of the most important challenges, the equitable access to quality healthcare. And when we say equitable access to quality healthcare, recently we were also doing some kind of a project with government of Bihar with respect to challenges of the healthcare industry, specifically with the primary and the secondary healthcare in Bihar. We got that, right? That's basically a drastic difference or the divisions of the equitable access to healthcare between the urban and the rural areas in Bihar. Not only Bihar, it's also the fact of India. So given that fact, now digitalization is actually the medium where the rural and the interior parts of India will be able to get that access to the quality doctors. But that's why the e-Sanjeevani app and many telemedicine apps are there. And specifically, this e-Sanjeevani is a initiative by the government in partnership with the state governments as well. So that's what exactly where the remote places people can access to the specialists or maybe the doctors and get that telemedicine remote consultations done. If you look at now medtech, now if you look at the health industry or health as a sector, the growth and the investment is maximum happening in the digital or the tech-led healthcare startups. It may be products, it may be also, you can say, some kind of services. And if you look at, this is the ecosystem that we're talking about, since digital health is driving the entire healthcare delivery systems in the country now. We can talk about that the startup ecosystem with more than 5,000 healthcare startups are reshaping how diagnostics used to be done, how pharmacy used to be done, how doctor consultations are used to be done, are now completely changing the game and plotting a new game altogether. And nevertheless, we should, thanks to the, I should not say thanks to COVID. However, digital health can say maybe thanks to COVID impact. And that's what exactly when we said when the entire healthcare ecosystem was disrupted, the challenges were coming up, and we saw that it's a completely broken healthcare system. The savior was only digital health, and the way also we got that digital payments as well. Similarly, digital health also gets a big push from that COVID-19 impact. So these are basically, you can say, talk about the key drivers of the growth. But again, as I said, this is the boring part of the session. From here onwards, I would look forward to your interactions. Now, the first question for you, and I would like to have some answers for this. If I ask you a simple question, why people use certain products and service? Can I have some answers for this? Yes, can I get some answers? Why people use to fulfill their requirements? Okay. Can you elaborate what are their requirements? What are their needs? To meet the needs, okay, fine. What are the needs? Their physical or the psychological requirements. Can you give me some examples of physical requirements and psychological requirements, Pulkit? So what are the physiological CPD, CDP therapy? What is that CDP therapy? If they need any goods or service, but why they need? Physical fitness is talking about, okay, to check whether these requirements are met correctly or not. Okay, fine. So when do you zero down? You might have gone to do any kind of shopping, right? So given that context, can you tell me how do you zero down on a specific product or on a specific service? Let's forget about health. Let's forget about health now. Let's talk about simple when you are going to any kind of shopping and while you are evaluating the options, where do you say that this option is best for me? Ratings or the feedbacks, okay? So what basically these ratings or the feedbacks helps you to understand? 360-degree checks, feed forwards. If a person suffering from fever, then he wants to decrease his body temperature, so that's okay, fine. Let's move forward. Let's go beyond health. Let's talk about from the generic context, and then we will enter in health. Customer reviews, fine, that's okay. But what customer reviews does? How customer reviews help you? How do you decide upon and address these issues, okay? From impact of product in market. I did not understand. Comfortable reviews. The reviews help us decide on whether to buy the product or not. How? My question is that how the reviews helps you to decide whether to buy this product or not. To identify a better product. When do you say it's a better product? Again, my question would be, as you said, Lalit, that to identify better product. So when do you say it is a better product? Help the management team to keep the tab, every single thing going around us, especially during a crisis like a pandemic or what, good experience or of other people, okay? He's talking about, Amar is talking about some kind of experiences, okay, fine. Based on this good experience of other people, he would say it's a good product, okay? The review gives us experience of customer regarding the product, okay? That's what exactly Amar also talked about. Apart from experiences, anything else? Okay, better price. Person is talking about better price. It would be a better product for me when it is in budget. Okay, fine, absolutely. It's in budget and at the same point of time, quality. The reviews are not always correct. Yes, absolutely, Vashant, because first when I book a hotel on Make My Trip, the first review gets, oh wow, absolutely fantastic hotel and 5-star rating. The next rating will be a kind of 0-star or maybe 1-star, absolutely pathetic one. So reviews are very confusing at some point of time. Help me make comparisons between products. Absolutely, yes, Prasanna. Okay, thank you so much. So it's good to see that many chats are coming up. So given this, now, if we look at what exactly or how does it help us or when do we arrive at a decision that, okay, this is the product suiting me and this is the product best for me, I should buy. One simple decision. One simple thing that helps us to decide whether I should buy this or not. That's basically, if you look at value. But sometimes rating got wrong. Absolutely, yes, Siva. Are you able to see that, right? What is customer perceived value? If you look at the left side of my screen, here I'm talking about one phenomenon called as customer perceived value. Absolutely, value for money you're talking about, right? So it's basically, if you look at, you take any product, you are going to buy a watch, you are going to buy a mobile phone, you are going to buy a photo frame, you are going to buy a dress, you are going to buy anything, laptop, you are going to buy car, what you are going to buy, anything else, whatever you say. Only thing is that we always compare two things. And this comparison does not happen, might not happen on a pen and paper. This comparison happens in the mind of the consumers. And when we say what happens, what goes inside the mind of consumers. If you look at this, we try to compare these two things. One is, what are the total benefits that I'm going to get if I'm going to use this product or maybe use this service, and the total customer cost. What are the things that I'm going to input? And when I say cost, it's not only about the monetary cost. If you look at here, I'm talking about how much money I'm paying. That's okay. But sometimes there are too many risks also being involved. I'm paying some money. I might be paying less money, or maybe that might be very, you can say some services are free of cost, but it might be risky. Or maybe it might be taking some time, lot of time from me. My transaction costs are higher. So it's not only about monetary cost. It's about how much of money, how much of time, how much of energy, how much of risk I'm able to take, vis-a-vis what are the benefits that I'm going to get. And that's what exactly when we say, I say that something is value for money. And when I say value for money, the definitions of value for money changes from person to person. It means how much money I'm going to put in, how much time I'm going to put in, how much energy I'm going to put in, what is the risk profile, vis-a-vis what benefits I'm going to get. But always, what happens? As simple as that. When, as a customer, when I feel or when I find that the total benefits is a surplus compared to the total cost, or maybe benefits, when I weigh the benefits and the cost, and I find the benefit side to be higher compared to the cost, a perceived value is being created. And that's what exactly when the perceived value is created, or when the value is being perceived in my mind, I, as a consumer, develop some kind of inclination towards some, or maybe towards some kind of services. That's very simple. So then, why we are talking in the context of digital health? Let us go more deeper into this. That means, be it any product or any service under the sky, when it is made for people to use it, it has to offer some kind of value. And when I say value, that means the benefits being offered by this product or maybe service needs to be higher compared to the cost. So that means now we should talk about what is customer value or what is user value. Because without value, nobody will use anything, if at all, it is being also provided at a free of cost. If I'm also going to give you something at free of cost, but it's of no value to you, maybe I'm a friend of yours, that's why you may take it in front of me, but the moment I turn my back, you will leave this product, or maybe you will throw that away. So that's why let's look at what is this concept of customer value, so that everyone, every service provider, every marketer, be it product, be it service, has to create that, has to communicate that value in order to first, and that's what exactly what we say, that people will come forward and use you. Why? When they will see the value. So then, now my question is, how this value is being created, how this value is being communicated. That's why, that's what also applicable to digital health, because digital health is not only what they're giving, they're either giving a product or they're giving a service. So when there is a product or service, nothing else, but it's again, it has to be translated into some kind of value, without which people will not come forward, people will not buy you, people are not going to subscribe you, people are not going to download the app, people are not going to use this app. So then let's look at what this digital health can offer in terms of the value, so that it influences the mind of the user and influence them to come and use me. So look at here. This is the value framework. When we talk about the customer value framework, this is the most important, or maybe you can say the most popular value framework we talk about, any product or service under the sky talk about, if you summarize what kind of value they create and communicate, they are four, it's a four-tier value systems. The four-tier value systems are, if you look at, therefore, one is the functional and the instrumental values. Second one is cost and sacrifice value, experiential value, and then you have got symbolic value. Let me let's go into a deeper discussion about each of these values, and then we will connect it to the digital health systems. Let's first talk about the functional or the instrumental value. So how marketers, how products and services can create and communicate this value. Let's look at one. So it says, the extent to which a brand has desired characteristics that is useful or perform or desired function. Fine, great. I will ask a few questions here. I'm sure you might have heard about, or you might be using different toothpaste from Colgate, or maybe from Close Up, or maybe from Pepsodent. Can you write down on a chat box why somebody is using a specific toothpaste? You write down your brand name, which toothpaste you are using, and tell me why. See, we are now going to very generic, and then we will enter into digital health value. My question is very simple. We all are using, yes, Khwaja is talking about Sensodyne. Why? Also write down, please, why. You are using Sensodyne, why? I use Purpura because it's SLS free. Okay. Individual dental need. Smartwatch. We are not entering into Lalit. We are not entering into now digital health. I'm just talking about toothpaste. Dant Kanti, because it has exceptional cleaning quality. Okay, fine. Sonu is talking about, he's using Dant Kanti because he believes that it has got exceptional cleaning quality. Okay. Colgate he uses because of results and the trust. Shivam is talking about based on quality and has no side effects. Which toothpaste, Shivam, you are talking about? Patanjali Dant Kanti, various benefits like antibacterial property. Dabur Red, okay, Dant Kanti, ambassadors. Close Up. Why Close Up? Harminder Pal Singh. Why do you use Close Up? Khwaja is talking about for the dental health purpose because he's talking about Sensodyne, right? When compared to dentist recommendations. What he's talking about, okay? Bollywood heroes and sports persons are using it. That's why it is attractive. I'm using Close Up for cooling sensation with good smell. That's fantastic, Sanjay. Thank you so much. Anybody else? Kids and school-going kids, okay? Attractive ads and marketing. Colgate Visible White for whitening teeth. And college kids, okay? Super. Fine. Thank you. Thank you. Thanks for all these inputs. Thanks for making this class interesting. I hope you're also getting some kind of interest into the class. So let's talk about then, what is this functional or the instrumental needs? And kids spoil parents' mental peace. Yeah. So as you can see, many people have been talking about, Amar is talking about Colgate for visible whitening teeth. Or maybe somebody else was talking about your Close Up because of cooling sensation with good smell. Or maybe somebody was talking about this Dant Kanti because it has got good antibacterial properties. Somebody was talking about again that Purpura because it is SLS free. So what does it mean? If I talk about Colgate as a toothpaste, like most famous one, what Colgate does, if you look at their ads, because many people have also mentioned about that, their ads are interesting. if you look at Colgate has got different toothpastes, different varieties of toothpaste. And for each toothpaste, it comes up with specifically says, one, the Colgate sensitive, which says if you're going to use it, it has got pro-arginine formula. And as a result of that pro-arginine formula, it's going to reduce your sensitivity of the teeth. That's what Colgate sensitive talks, or maybe with Sensodyne also talks about that. Colgate active. Sorry, it's not active. Colgate fresh active gel, something kind of things where now Ranveer Singh is coming up. He's talking about that freshness of the smell. Or maybe आप लोगों ने बहुत पहले देखा होगा ad that was specifically Colgate active salt. क्या आपके दांतों में दर्द है? क्या आपके टूथपेस्ट में नमक है? Do you remember that ad, right? Or maybe Colgate Veg Sakti that talks about the toothpaste having, or maybe Dabur Red, which talks about that, or maybe Patanjali also, Dantkandi talks about specifically the Ayurvedic ingredients, and as a result, those bacteria-free cleansing property, masude strong honge, dant khil uthenge, right? All this kind of thing. Yeah. So instead of TV, smart TV, idiot box replaced by smart idiot boxes, and we smarter kids, and we forced to become extra smart, alert, maintain a digitally healthy lifestyle. Okay, fine. So that's what exactly when we look at here, what basically they are highlighting. It's a common pattern. The common pattern is in all these products that we talked about, in everything, if you look at what they're trying to communicate and trying to create the value is, they are highlighting what is the unique selling proposition in that product in terms of the feature, in terms of the ingredient, and because of this feature, or maybe because of this ingredient, or because of this entity, this specific feature, what direct benefit the user is going to get. That's why at some point of time, Clinic All Clear also launched an ad called as, do you have license to wear black? Why they're talking about, do you have license to wear black? Because if you wear black, and if you have got dandruffs, the dandruffs will fall on your shoulder and it looks bad. And you may be feeling bad. And that's what exactly Head and Shoulder also talks about. That ZPTO formula. This shampoo has got ZPTO formula, and because of this, it does not like the dandruff ko aane nahi dega. So all these brands, what they're basically talking about, the functionality or the utility that consumers are looking forward to. When I say utility, it's basically the benefit. Or maybe if you look at the Excite batteries, Amaron batteries, they talk about the longer, or maybe Duracell, it talks about the long run. So what benefits exactly I am going to serve, going to deliver to my user, because my product, or my service, or my brand has got this specific, you can say, features, or maybe the ingredient, or maybe the specifications. And that's what exactly functional or the instrumental value. And of course, people trust it. If you look at, many people change their soaps even while we starting, from when the season changes from the summer to rainy to winter. When winter comes in, many people shift or change from another soap to a Dove, or maybe to a Pears soap, because people believe that Pears is less harsher on my skin. Yes, Jenny is talking about, yes, sir. Why it is so? Because you believe what Pears told you, कि इस साबुन में glycerin है. And when Pears says that इस साबुन में glycerin है, you also believed it, and you also believed that due to this glycerin content, my skin is not going to be that, you can say, rough, what other soaps has been. Or maybe Dove talks about that 25% or 1/4 moisturizer. It's not a soap, rather it's a moisturizer, and we tend to believe it, and after believing it, we are using it. That's what exactly called as the functional or the instrumental value, where the marketer can highlight, or maybe any product or service can highlight its specific feature, and because of that specific feature, what is the direct benefit that's going to provide to the customer. That's called as my functional or the instrumental value. Let's go to the second one. The second one is basically, as we said, it's called as my cost or the sacrifice value. So when I say cost or sacrifice value, sorry, that's the second one we'll be going through. Clockwise we are going. So experiential value. So when I say experiential value, look at here. It says the extent to which a brand creates appropriate experiences, feelings, and emotions for consumers. That means the brand can say that if you are going to use me, or if I'm going to be a part of your life, I can give you really good sensory and emotional experiences. Like, if you talk about movie halls, many people choose Inox Insignia. Why? Because the experience of watching a movie over there is completely different of experience of watching a movie in other theaters. Or maybe when you talk about the amusement parks, different amusement parks, why do we again go to a specific restaurant in that particular region? Because it gives me good ambience, it gives me good food, it gives me good service. And when we talk about this ambience, or maybe food, or maybe service, it's all about the experiences that's going to be delivered to me. Some people choose, maybe when we talk about coffee drinking habits, some people, they choose Starbucks, some people talk about CCDs, and some people talk about barista. And can you just think about, when people go to Starbucks only for few experiences, and just look at how we are mad about that experience when we go to Starbucks and they write down our name on that Starbucks cup of coffee, and then wherever we are, we open up our Instagram or maybe our Facebook account, social media account, and we share that, right? What we are basically sharing, that gives us a good experiences without any cost. And look at, for that experience, I'm going to pay also heavily to Starbucks, and I don't mind that. So that's called as my experiential value. So it's all simple as that, how good your experiences are going to be. That means the brand is saying that earlier your experiences are not so good, but now I'm going to talk about, I'm going to give you some kind of good experiences. Ghar ka adrak ka chai and samosa, chutney is the best. The rest is an experience of Western culture. That's okay, fine. Absolutely fine, right? Great. So next, coming to the third one, that's symbolism. So when we talk about symbolism, let's look what basically they are saying. The extent to which a brand or consumers attach or associate some kind of psychological meaning to a brand. Fine. So let's look at some examples. I think cars luxury, okay? So I think everybody, forget about cars. Let's talk about products which are being daily used. I think everybody knows about Thumbs Up, right? Or maybe everybody knows about Mountain Dew. I hope everybody knows about this. And I'm sure that you might have also seen the ads of Thumbs Up. What basically it says, if you look at Thumbs Up's ad, what basically it says, or maybe what Mountain Dew says. Anyone? What Thumbs Up says? Taste the thunder. Yes, taste the thunder. Mountain Dew says, "Dar ke aage jeet hai." Absolutely yes. Thank you so much. They will not only taste the thunder. At some point of time, Mahesh Babu Thumbs Up हेलीकॉप्टर का पीछा करते हुए एक छत से दूसरा छत पर कूदते हुए he talks about आज कुछ तूफानी करते हैं, right? And similarly, your Salman Khan comes in and finally he says, taste the thunder to hey. At the same point of time, he say, मैं तूफानी हूँ, and thumbs up the bottle से मैं तूफानी हूँ निकल गया. Yeah, maybe thumbs up, yeah, maybe Mountain Dew talks about that. डर के आगे जीत है. So when we talk about this, now look at thumbs up or Mountain Dew does not talk about their prices in their ads. Again, thumbs up or Mountain Dew, they do not talk about, again, further, you can say, talk about what is the ingredient present over there. Do they talk about? No, absolutely not. So what basically they're talking about, what basically they're highlighting when they say कि डर के आगे जीत है, that means, or maybe taste, मैं तूफानी हूं. Thumbs up says that I am a person like you. When I say I'm a person like you, absolutely, they're promoting their products, but how they're promoting their products? I am a person, thumbs up says that I'm a person like you, or maybe Mountain Dew says that I'm also a person like you. But a person, what is a lifestyle? Me as a person, मैं डर से डरता नहीं हूं. Mountain Dew बोलता है मैं डर से डरता नहीं हूं. अगर आप भी डर से डरते नहीं हो तो absolutely, but soft drinks are garbage. That's okay, Vishal. That's absolutely fantastic. So that's like, but at the same point of time, whatever you say, people drink a lot of soft drinks, right? So let's focus on to the context. What basically we're trying to understand. So when we say thumbs up बोलता है कि misconception of confidence Mountain Dew. That's okay, fine, absolutely. So let us talk about what is symbolism. Oh my goodness, Khalid, they are harmful to health. Absolutely, we know. With understanding that harmful to health, you might be also drinking that thumbs up, or maybe drinking Fanta, or maybe drinking any of the drinks. So let's not talk about that. Fine. So given that context, let's understand what its symbolism. We are not debating here whether they are good for health or they are bad for health. Absolutely, yes. Anything excess is harmful. We are trying to understand what its symbolism. We are not debating whether cold drink is good or cold drink is bad. Let's not focus there. So let's focus on what its symbolism. So when thumbs up says कि मैं तूफानी हूं, that means it says मैं तूफानी हूं, क्या आप भी तूफानी हो? If you are also tufani, then at the same point of time, it's the point where you and me are basically matching the frequencies. देखो, शादी करने के लिए 36 गुण मिलने की जरूरी होती है, दोस्ती करने के लिए एक ही गुण काफी है. And that's what exactly symbolism is all about. Symbolism is creating that synergy between the brand, between the marketer, and the people over there and the user. That means I'm talking about me as a brand. I have some kind of personifications. It's more often a personified ones. And being a personified ones, the same personality or characters or maybe lifestyle I represent is equivalent to characters or the representation or might, that's a great example. So I totally agree. Yeah. So it's the very, very similar characteristic feature you also are having. Like the way, it's not only that one. Let's talk about Royal Enfield also, right? When we talk about Royal Enfield, it talks about Explorer. If you look at Royal Enfield Meteor 350 ad, it talks about I am an explorer. So what does it mean? So the motorcycle talks about himself, like it says that I am a person, I may be he or she, but when I am saying I am he or she, but basically I am an explorer. I do not leave out anything without being unexplored. And that's why they say, do not leave out anything. I am a traveler. And at the same point of time, it says, trekking, breaking balls are dikhanda, right? And it says, it's basically, I'm an adventurous also. And that's why people having these kind of traits would go forward and they associate their personality with the personality of Meteor, and they find that okay, Meteor is the best product for us, and that's why Royal Enfield is the, you can say, having the highest market share in that specific category. It hooked onto the customers. I hope the concept of symbolism is clear. Is clear, right? GT 650 is best son. Absolutely fine, no problem at all. Even I'm planning to buy this 651. Okay, super. And then coming to the last one, that is cost and sacrifice value. So when we say cost and sacrifice value, what basically it is? It says the extent to which a brand minimizes the cost and other sacrifices. That means the brand can say, or the product or the service can say, if you're going to use me, I am going to reduce your time. I am going to reduce your cost. Not only cost, I'm also going to reduce your time, energy, effort, and the risks are being associated. If you look at one of the best examples are the way digital payments have got that acceptance among people. So why digital payment has got a lot of acceptance among people? Because of this, the majority cost and sacrifice value. And if you also look at the firm's communication, be it Paytm, be it your Google Pay, or maybe the government's communication, what basically they talk about? If you look at their communications, what they say, the most important point is they talk about digital payment is easy. And when I say digital payment is easy, that means if you have got only bank account, but you do not have a digital payment kind of app, for that, for a transfer of money, you have to go to bank or maybe open your online banking account. It takes time. Sometimes if you go to bank, again, it's a half day of work. Whereas when we talk about digital payments, it's an app-based service, download, use it, make the transactions happen within seconds. So it saves your time, saves your energy, saves your effort. And then at the same point of time, what they say, the digital payment, when we talk about, it's not only that, it also talks about that many of the time we use GPay, many of the times we use Paytm or maybe Phone Pay, because we find that with many transactions, we get many coupons, discounts, etc., etc., and that saves my money for the next transactions. So it's economical as well. Not only that, government also talks about this. If you're going to pay some bills through digital mediums, they're going to give you some kind of subsidies. So it's also reducing your cost. It's also reducing your time and energy. Even if you look at government's communication with respect to the digital payments, they talk about it is safe. Why? Because though there are so many issues with respect to cyber crimes and all, sustainable development option, absolutely, yes. Government talks about also why digital payment is safe, because of a physical cash loge, so there is a chance of theft. There is a chance that the cash gets damaged. There is also a chance that the cash that you are carrying, it might be a duplicate currency as well. Yeah, it may be also stolen. Here they are saying that it is more safer options. However, it's also having some kind of challenges with respect to cybersecurity and the cyber crimes. Yes, and that's what government is trying to, you can say, improvise this safety and the securities. And that's what exactly we're talking about, the cost and sacrifice value. So I hope everyone is aware about what are these customer values. And is this clear to everyone? The 4 different values that any product or any service should provide in order to hook onto the customer's mind. And you can say that I am a better product or I'm a better service for you because I am providing this value. Without any value, no marketer will succeed, no product will succeed, or anybody will not develop some kind of positive inclination towards. So given that context now, the four values, let's look at how then digital health service providers, they create and are communicating the values. So what I'm going to do now, I have earlier I had some videos to show you with respect to this, but while we were doing the test run, my video access, like I'm not able to share the sound, so it's not going forward. And then I decided to add on some of the print ads. So what I'm going to do now, I have around 10 odd print ads. I will scroll them down one by one, and I will ask you, look at this ad. And every ad, there is a digital health service provider, and with a print ad will be there. What you need to tell me is that you are now clear about the four values. Now you tell me in this ad, specific ad, which value is being communicated. Is that clear to everyone? Your task is, I will show you the ad and you will tell me which customer value out of the four. It can be a combination as well. So which customer values are being highlighted over there? Let's go one by one. Let's start with the first one. Pharmacy. Yes, I would request on the chat box, please come up with your answer. Look at here and tell me which values are being tried to be communicated. Absolutely, yes. It's a cost and sacrifice value because they're talking about specifically on 20% bachayega. Cost and sacrifice. Absolutely, yes. Correct. Thank you so much. Next one. Let's go to the next one. Again, the same pharmacy, which talks about express delivery. So which value they are talking about? Time, absolutely yes. So if I say time again, that means it's saving your time, energy, effort. Ghar baitha baitha express delivery. So again, it's a cost sacrifice value. To some extent, yes, Jenny, we can also talk about experiential values. Yes, why not? Fine. Coming to the next one. If you look at NetMeds, look at these ads. What they are talking about. Cost and sacrifice value in terms of 20% flat discount, 10% unlimited MMS cash, or maybe MRP at the end. Those are cost sacrifice values. Apart from cost sacrifice values, which are the other ones? That's okay, Monica. Now we said it's already discounts. Experiential value. So why do you believe that, Pulkit, that it's an experiential value they're talking about? Cost and experience. Absolutely, yes. Cost and experience. They're talking about India ka khayal rakhna. It's a care they're talking about. Experiences. Not only that, look at here. They're talking about the widest range of medicines available. That means they're talking about the functional values as well. And the delivery promise you can counter. They're talking about the trust and the promises and the care being delivered. That's why they're saying India ka khayal hum rakhenge, aapka khayal rakhenge. So it's more of, again, it's again to create competition. Absolutely, yes, why not? But what they're basically talking about, they're talking about cost sacrifice, they're talking about functionality, they're also talking about experiences, feelings. Absolutely, yes, Jenny. They're talking about feelings as well. And when we say feelings as well, it's basically your experiential values they are also trying to communicate. Let's go to the next one. If you look at here, which values? Tata 1mg. your trusted diagnostics labs. By saying this, what exactly they are talking about? Which value? Symbolic, okay. Why symbolic? Because they're talking about the Tata and it's T for Tata and T for trust. And the Tata's trust is being transferred to Tata 1MG. And that's what exactly the branding. Everything is a branding. So if you look at Amar is talking about branding. Yes, Amar, everything is a branding. Like whatever ads we talked about, be it Netmeds, be it your pharmacy, be it Tata 1MG, everywhere they're trying to talk about branding. But when we talk about branding comes with some kind of values. Brand without a value, a name cannot ever be a brand. To become a brand, the value needs to be synonym. So brand को value का dress पहनाना पड़ता. And that's what exactly here we're talking about. Tata. Tata stands for trust. And that's why exactly Tata 1MG also talking about trust, which is more of a symbolic one. If you look at here, again, Tata 1MG, it's talking about bringing care to health. So which value they are talking about out of the four? It's specific to this ad. Which value they're talking about? Experience, okay, experiential, because they're talking about the care, and care is basically a feeling, an emotion, an experience. That's why experiential value. Fine, great. If you look at Practo, a digital health consulting, right? So it's talking about, if you look at this ad, vaccines at home for women's experiential, absolutely. So Jyoti, it's not experimental, it's basically experiential. There is a difference between experimental and experiential. It's basically value is experiential. So it's that means Practo, it's personalization, experiential, right? So that's basically the experiential one. Again, look at here. Practo is talking about Swasth Nari, Sasakt Parivar, Viksit Bharat. Which value they're talking about in this ad? Women empowerment, yes. If it is women empowerment, it's not basically functional. Functional is basically, if Practo says this many doctors are there, if you're looking forward to this kind of treatment or this kind of consultation, we have specifically this kind of consultation, that would be a functional value. Whereas here, it is talking about women symbolism. So women empowerment and trying to connect with the empowered India and developed India. That's why it's more of a symbolism kind of things than that of the functional ones. So it's specifically talking about that symbolism as a value. Next one, if you look at Healthify Me, I healthified from 96 to 56 kgs. So what basically, which value it's talking about? Is it cost? No, not exactly. Functional, absolutely yes. It is more of a functional and also would be to some extent experiential. But basically it's a benefit that this ad is talking about, how a consumer, how a user who has got some kind of benefits after using Healthify Me. And that's what exactly functional and the experiences that the person is going to share. So majorly functional and secondarily experiential. Look at here, MediBuddy is another app. It is talking about a specific term. It's again different from personal experience and how we benefit of the product and help us feel and look better. Fine. So MediBuddy Gold, it says 24/7 availability of doctors. Then we are also providing a video and audio call chat. Cost, okay. Cost and sacrifice. So it will be more than cost and sacrifice. It will be, again, combination of three. Here specifically, it's not talking about cost and sacrifice directly, but it's talking about some of the functions which are available. So functional, yes. And at the same point of time, experiential, yes. And then you can say, because at home, I can talk about the expert doctor consultations for the entire family from the home, absolutely, yes. And that's why it's talking about a cost and sacrifice. So it's a combination of functional, cost sacrifice, and experiential ones. If you look at this side, Medibuddy, it's talking about your health buddy. So which value they're talking about? This is not cost. This is more of an experiential or maybe some kind of symbolic. Yes, I agree. Now this one, if you look at I'm fine. I'm fine is another app. If you look at these two ads, which values they're talking about? Functional and the cost. Yes, functional value they're talking about, and at the same point of time, they're talking about the cost value. Okay, fine. Thank you. So now, I hope the concept of customer value is clear to everyone. Can I get some thumbs ups if it is clear? Yeah. Thank you. Thank you, Kalim. Thank you, Jenny, for your response. So that means when we say this customer value, we have a framework called as a customer value proposition canvas. How to attract your customer, or how to find that, or how a customer will find that your product or your service is fit for him or her. This is the canvas what basically any marketer can talk about, any products or any service talks about. That means if you look at here, the right side of this canvas is the customer, and the left side of this canvas, it's basically the provider. And here, if you look at, here is a customer or here is a user, and this side is a digital health provider. You can talk about if you split in the context of digital health. So what basically, if you look at the customer profile, three things are there. One is the customer jobs, the pain points, and the gains. If you look at here, how can I describe here is that when I say customer jobs, that means what basically the potential customers are doing right now to solve their problems. They have some kind of problems. So what they are right now, they are doing. If I say practo like something kind of things, if I say my customer, my probable customers or the potential customers, they want to solve their health issues, and they are going and trying to take the appointment of the doctor and take the consultations and then take the medicines, right? That's what the customer job they're doing, or they are doing basically to solve their problems. So while doing so, what are the pain points of the customers? Where the obstacles are there. So that's what exactly the pain points. When I say the pain points, now I can say, okay, while somebody is going to meet and the doctor physically, एक दिन जाता है उसका अपॉइंटमेंट लेने में, अगर बहुत ही स्पेशलाइज्ड है तो एक दिन पहले से अपॉइंटमेंट लेना पड़ता है, या एक हफ्ता पहले से अपॉइंटमेंट बुक करो, उसके लिए जाना पड़ेगा, लाइन लगाना पड़ेगा, क्यू में वेट करना पड़ेगा आपको क्यू में, and then you get the access to the doctor, and then the doctor writes down a prescription. प्रेस्क्रिप्शन लिखने के बाद फिर आप कहीं पे लैब टेस्ट में जाओगे, और एक दिन जाएगा, लैब टेस्ट का रिपोर्ट कब आएगा? All of my pain points. So what basically the gains that customers are looking forward to? Customer को convenience चाहिए, कितना जल्दी easy way में मेरा ये problem solve हो जाए. I can easily consult a doctor, and I can get my reports done, and I can get my prescription easily and quickly. I need a convenient solutions out of this. And that's why Now Practo comes into your rescue. Left side is Practo. If I say Practo, the products and the services that is being provided by Practo is online consultations. Your next is your medicines delivery or medicine recommendations, pharmacy, or maybe also diagnostics. So given that, what Practo says that I am going to reduce your pains because अभी आपको एक दिन लग रहा है अपॉइंटमेंट पे, नेक्स्ट दिन डॉक्टर के पास जाने में, थर्ड दिन टेस्ट करवाने में. Now I'm talking about I am going to give you the easy consultation sitting at your home. So I'm going to reduce your time. I'm going to reduce your energy. I'm going to reduce your efforts. That's the pain being relieved. And what gains I'm creating at the same point of time? I'm giving you convenience. And at the same point of time, I'm saying, well, along with this convenience, I am saying that Practo has got the listed doctors, best of best doctors of India. It's not only the regional doctors. I am giving you the access to the best of the doctors who is sitting at Delhi, I guess. Or maybe uske upar, I'm also giving you first consultation by 20% off. Or maybe I'm going to give you that one-stop solutions for all your health needs. That's basically the gain I'm going to give you. It's not only the doctor's consultation part, but I'm giving you the gains. That's the one-stop solution for all your healthcare need sitting at your home. That's what exactly Practocat talks about. And that's what exactly we're talking about, making my products or services fit to the customer's requirement. And that's what exactly we say, market and the product or maybe the offerings fit. If I'm not able to do that, I will not be able to induce the, you can say, behavioral intentions among my potential users. I hope this concept is clear, a value proposition canvas. Can I get some responses, whether yes or no? Fine, that is clear. Thank you so much. Now, going to the next one. Just wanted to have some activity here, but it's okay, fine. I guess time will not permit me. Fine, I'll go to split it up. So now, let's again come back to our context, that digital health. Why we are talking about digital health? Because this is a text I got from Deloitte. So it says, future of healthcare will be different from what it is today. And Deloitte says that it's going to happen because of mainly 3 reasons. And what are these 3 reasons? It says one is focus on prevention than that of cure. Because now we're talking about the entire world. In the entire world, the health systems are now moving from a curative health system to more of a preventive health system. And given that in India, if you look at, in India, we are going through a triple burden of disease. What do I mean by that? When I say triple burden of disease, I have got communicable diseases like malaria, like TB, like filaria. So those kind of diseases are still there in India. I am going through second burden. It's a bomb that we're talking about. We're sitting on the lifestyle diseases, the diabetic, the cardiovasculars, all those kind of problems. The lifestyle diseases I'm sitting on, piling upon. Also, the road traffic accidents and the traumas, those are happening. So it's a huge burden on the entire health system. So given that 140 crore ka janta hai, if I will be still focusing on the curative one, that's what exactly happened during COVID. So we do not have that health infrastructure to take care of 140 crores janta. And that's why it's better that we should move gradually from a curative one to more of a preventive one. And for preventive one, yes, we are forgetting that health is wealth. For the preventing one, we have to induce some kind of healthy behaviors. And when we say we're going to have some healthy behaviors, this digital health tracker, wearing devices, all those kind of things, they are a partner. They are going to partner with us to remind that you have to come up with a healthy habits. Or maybe second one, we're talking about interoperability of the data and the platforms. With the increased data points, your health records are there. Our IDs are being created. Unique health IDs are being created. Your clinical data are being stored. And this will gradually improve and help me to interoperable those platforms. And at the same point of time, this consumer engagement and empowerment, because the healthcare, it's from the masses, it's going to be more personalized healthcare. Even now we're talking about medicines, they're talking about genetic targeted therapies as well. So more of personalizations are happening, because in healthcare also we're talking about consumerism. So given that all this, digital health is the, you can say, term which can solve all these kind of things. And that's why we're talking about the growth of digital health. If we look at this one example, how digital health is shaping up the healthcare industry, just one example from pharma. I'm not talking about many things, but just one example if you look at the entire cycle. It's if you talk about only medicines, look at here, how digital health is helping us discovering new medicines, because we have got lot many data points, helping us to research. Even AI, ML has entered into pharma industry. Last time, like I was talking to the senior director of LLI as well as Pfizer, the product head, they were explaining how AI, ML and those data are being used to predict the patterns, analyze the genetic patterns, and develop some kind of new solutions. That's digital health. Not only that, it's also talking about developing medicines with patients, because it's again greater understanding of the patient's needs are there. Well, that's why well-designed clinical trials are being there, and it is helping us co-creations of those medicines or maybe therapies. Not only that, it's also making us the distribution channel more and more effective. And that's why this pharmacy and all those kind of things we're talking about, deliveries, express deliveries and all those. Not only that, they're also like MediBuddy platforms and all. They're able to help us track, give me reminders that doses should not be missed out. That's why they are supporting the medicine in use. Not only that, they also, these platforms also, they monitor the medicines and the supports. And that's why it's a simple example of only one example how medicine, use of medicines, production to use are being reshaped by these digitalizations. There are many such examples are there. But what are the major challenges if we talk about digital health, and specifically in the Indian landscape? What are the major challenges? Again, simple things. The challenges can be clubbed into many barriers or many factors. One is technological barriers, limited internet access, lack of interoperability, cybersecurity, insufficient training for healthcare providers as well. Because we were doing a project here, and when I asked my doctors that, okay, now government is focusing on digital health, the entire BHC, entire CHC is being you're digitalized, but now doctor is giving the resistance to me. डॉक्टर मुझे बोल रहा है कि सर गवर्नमेंट को थोड़ा बता दीजिए कि मैं पेशेंट को देखूं या इधर लैपटॉप में या कंप्यूटर में एंट्री करूं, क्योंकि मेरे पास पेशेंट का ओवर, दिस इज एग्जैक्टली व्हाट आई एम सेइंग, अ डॉक्टर टोल्ड मी, नॉट ओनली वन डॉक्टर, मेनी डॉक्टर्स. सर हमारे पास 400 पेशेंट आते हैं एक दिन में, 1 मिनट में नहीं होता है पेशेंट को कंसल्ट करने के लिए, हम इधर पेशेंट को कंसल्ट करें या इधर लैपटॉप में बैठे. दैट्स द प्रॉब्लम, right? Infrastructural challenge. limited healthcare infrastructure, supply chain, those kind of things. High-speed internet connectivity is an issue in the remote areas specifically. And again, in the remote areas, we have got still electricity outages and all those kind of things. Even the barriers with respect to regulations and the policies. We do not have a proper regulatory framework for digital health implementations, though there are some standards are now talked about, NABH and all those kind of things. Data privacy laws, it's not full-fledged in function in India. But we do not have our regulations with respect to telemedicines. The way we have got some regulations in Sweden, we have got some regulations in other countries, but yet in India, we do not have specific regulations with respect to telemedicine usage. Financial barriers. Yes, initial investment would be high to develop those apps or maybe to develop those infrastructures. Not only that, at some point of time, affordability can be an issue. Lack of government fundings for this, though it has been little improved. And some kind of socio-cultural barriers. That's normal. Resistance to change. Digital literacy, I might not be knowing how to operate this. I might be having lack of trust in the digital health solutions because I still believe कि डॉक्टर के साथ मैं जब बात करता हूँ सीधा आमने सामने बैठ के तो तभी जाके है, यहाँ पे नहीं हो पाता है. That might be an issue. And sometimes, yes, language and the acceptability issues, because most of my apps and everything are in English, though there are multi-language or those kind of things, but many of the times this language issues are there. Now, given this, let's not focus on this one. Rather, we will talk about inducing the behavioral shift. One of the biggest challenge that we encounter is when we talk about this digitalizations, digital health, though government is giving a lot of push, there has been so many private companies are coming up, still we're talking about how people will shift from a physical consultations or maybe some kind of this physical usage of the hospital space, and they will move towards the digital health. How to induce this behavioral change? That's the big question mark now. That's a big challenge. And that's why also a few months back, last year, this National Health Authority was organizing an workshop for all the joint directors of all the states of ABDM. And they also invited me to have this workshop on this behavioral shift or the behavioral change with respect to specifically digital health adoptions. Here, I will talk about two models that can be incorporated to have that greater behavioral change. That's the psychological model, while marketers can also use this, or maybe this kind of service providers can also use this. So one is, let's talk about the hook model. How does it work? When we say hook model, it's very simple. The hook model says that means I am a service provider. I am providing something, maybe a product or maybe a service. How to hook onto the customer's mind so that now customer is hooked onto my products or my service. It says four things or four stages. One is, if you look at this diagram, this is called as the trigger. So what triggers the customer to show a desired action? And when I say trigger, it can be the internal need of the customer. Kuch problems hai, isliye I'm looking forward to that solution. Or maybe it can be a purely external trigger because somebody else has showed me this is better. Or maybe I saw this ad, it was very, very attractive. I got influenced by this information. That's an external trigger. Or maybe internal trigger is, I realize that, I reflect that, I need this. When something triggers, that means I need to create, as a digital health solution providers, I need to create that external trigger points. I need to create those stimuli, and those stimuli will come from my customer values. That's why we initiated these topic or discussion from this first framework of customer values. When my customer values are being highlighted, those 4 values we talked about. When we say that, that will trigger me, that will help me to get internal realizations. And at the same point of time from the external sources, it's going to trigger this starting point of this. This trigger leads to the action. Action means I am going to onboard. Maybe I'm an app-based service provider. When I start triggering based on the external and the internal with respect to the customer values, those trigger can be experiential values. It can be trigger with respect to your symbolic value, trigger with respect to cost and sacrifice value, and the trigger can be with respect to also your functional values. Given that trigger, somebody will show the action, the desired action. That means I, as a user, I am going to onboard that. I'm going to download that applications and I am going to subscribe that. Not only there, if somebody is showing some kind of an action, do that action, you should be able to give a reward. That's the reinforcement comes into action. And that's why somebody says, if you are going to have the first, like you can say, consultation, or maybe the first order, you are going to get this reward. If you are going to have this much of an order, this much of percentage of discounts are there. So these are the kind of things I can talk about, different types of rewards. Or maybe you are today a gold member. Tomorrow, when you purchase this much, you are going to become a platinum member or maybe a diamond member. And there are different types of benefits when you move from this level to another level. That's the reward we talk about. And not only that reward, we also talk about that what investments are being done, how to what extent I'm going to make it more and more personalized kind of things, so that what kind of, you can say, I am invested into each and individual so that he or she is not going to leave me, rather he or she is going to give me orders repeatedly. And that's why maybe और कभी आप लोगों के साथ सेशन होगा तो we talk about some kind of things called as biases, how marketers use different types of cognitive biases to hook up to the consumers. So it's basically to start a trigger to get the action, but the action to be repeated, what you do is that you give them rewards, and to save those kind of customers to not leave you, you have to invest in those customers. For rewards points, yes, absolutely. Next, another model here is, this is more famous model compared to the hook model in case of health behavioral change. And this is famously called as the COM-B model. And why it is called as a COM-B model? Because the COM stands for capability, C stands for capability, O stands for opportunity, M stands for motivation, and B stands for behavior. So how do you induce a specific behavioral shift? You want somebody to move to digital health applications. So how would you do that? It says you have to ensure capability among your audiences. You have to provide the opportunities, and also you have to present the motivations. That means now what happens? When I say capabilities, that means you need to develop the physical capabilities as well as psychological capabilities of people to use something. That means forget about capability first. Which will come first? The first is that first present the opportunity. That means make the digital health applications available widespread. First of all, that is important. Create those opportunities. That means social and physical opportunities. So social, physical, people can see that there is a physical infrastructure is in place. Social, other people are talking about. Peer pressures are also there with respect to using this. Not only by creating opportunity will lead to the solutions. In India specifically, we talk about so many kind of, digital literacy is also a little challenging. So when I talk about digital literacy, that's why this capability is more important. You have to train people. You have to make them understand how this digital health frameworks work. I'll give you an example. Now, I think you must be knowing about Asha Karmis, which are the last leg of the health delivery system in India. Government has also developed one M-Asha platform for their entire operations. And this Asha Karmis, if you look at, their 10th pass, somewhere 8th pass as well. We were doing a project with them, and while we were talking to this Asha Karmis, they specifically said, sir, हमें ये पता ही नहीं है इस प्लेटफॉर्म को M-Asha प्लेटफॉर्म को कैसे चलाना है, कहाँ पे इंसेंटिव कैसा क्रेडिट होता है, we do not know. I am going to home, मैं अपना बेटा का हेल्प लेती हूँ या अपना बेटी का हेल्प लेती हूँ. That means here capabilities. I need to. It's not only about creating opportunities. It's not that I have developed some kind of infrastructure. I have developed some kind of solutions. It's not that people will come and automatically use it. I have to induce the physical and the psychological capabilities. So trainings are important. Not only that, it also says that this model also says that कि आपने opportunity create कर लिया, लोगों को train कर लिया, they're also not sufficient. Then third, it says that with the opportunity and with these capabilities, we need to also provide motivation in the form of rewards. So you provide them the rewards, that's called as automatic and the reflective rewards. When I say those, automatic is more of financial rewards, reflective is more of my realizations. So give them the motivations, the sense of accomplishment, the sense of achievements. Not only that, you also give them some kind of rewards in terms of your financial or the non-financial rewards. So when all these things are clubbed together, then only a targeted behavior can be achieved. Like the way you can take example from digital payments. And that particular example of digital payments, in just 10 years, we are now #1 country in terms of digital payment usage. Similarly, it can be also applicable to digital health models. And if I talk about how digital payment fits into this COM-P model and how we can learn from this, if you look at opportunity, if you look at the opportunity, now, with respect to digital payment, look at how government has created this UPI. Earlier, it was only online banking. Now you have got UPI, the most easiest solution. And UPI is present everywhere. You go to a shop, you go to even a auto wala, you go to a rickshaw wala also is having UPI. That's the opportunity I'm going to create. It's so widespread now. Not only that, people also talk about, अरे सर change नहीं है तो ये तो UPI में pay करो ना, phone pay में pay करो. That's an opportunity of creating. But at the same point of time, government has also invested a lot in training so many people. There has been specifically dedicated channels, awareness campaigns. RBI talks about campaigns in the rural and the rural areas, incorporating schools and educational institutions to train the vendors, roadside vendors, to how to use this digital payments capabilities. Not only that, we're also talking about the motivations in terms of if you are using this, then there is no UPI charges, there is no transactions, it's for free. Not only for free, I'm going to give you some subsidies. I'm also going to give you some kind of discounts, some kind of coupons, all this kind of methods. And look at the change now. People have shifted from this cash to digital payment. I cannot say that people have shifted. Still, cash is a king. However, there has been a huge shift in the digital payment transactions in India. And that can be a great model where the digital health companies can also look forward to that model. And if they implement this, can't be modeled, and there's capabilities, opportunities, and the motivations. Just basically, this is called as a behavioral change wheel. If you look at here, the entire behavioral change wheel, that's what, if you can implement all these aspects, which a great example that already done in India, that's digital payments, similar kind of replications can lead to great results in the context of digital health as well. So with this, I would like to stop here with my content. And that's what exactly I wanted to deliver. So if there are any questions, I would like to take it up. I hope you find these sessions to be interesting. I hope I didn't bore you up. And I think our objectives are fulfilled. So can I get some thumbs up or thumbs down, whether you have liked it or not? Thank you, Sonu. Thank you, Aman. Thank you, Amna. Jetty, yes, absolutely. Thank you so much. Yes. Can I take up some questions? If there is some questions, we can take up. Rajput is giving me 6 thumbs up. Thank you so much. Thank you, Jasdeep. If there is any question, I'm open to take up those questions. I am so Jenny is asking about, sir, are you from Gaya, Bihar? No, I'm basically from Orissa, but now I'm a professor at IIM Bodh Gaya. How digital platform help physician doing own practice? Okay. So if you look at ABDM, so this Ayushman Bharat digital mission itself. Not only this, if you look at apps like Medibody and all. Oh, Jenny, you also live in Gaya. Fine, that's great. So at any point of time, you can come to IIM Bodh Gaya and we can meet. No problem. My invitation to you. So if you look at physicians, absolutely yes. It is basically a kind of, you can say, bridge between staying connected. If somebody is on digital health, now I can say my mother is now 72 years of old. She still gets consultation for her diabetes from Orissa because she believes that doctor is the best one. And I would also say the hats off to that doctor. He does through that teleconsultation or video consultation, though he does not use any other digital platforms. However, he uses simple GMate. It's also digital, right? So he is trying to stay connected with all their patients with the follow-ups. For the follow-ups, he said, if there is no such kind of, you can say, emergency, there is no need to come to my clinic. You can set up an appointment for the follow-ups. Their patient relationship department, it's a clinic, simple clinic owned by one diabetic doctor. His customer relationship officer, he calls up, sets up a meeting for the follow-up. You get the follow-up done and no need to come. And during that period, he onboards new patients as well. So no need to make his clinic very, very, you can say, crowded, because every day he's getting 100 or 200 patients, new patients as well. So it's not only that simple one like digital platform like Zoom, but yes, platforms like Medibody, platforms like ABDM and etc. are helping doctors to track their patients' records and easy, like you can say, make it easier for them to understand also what the patient's health is going, where the patients are going. That's what exactly the digital health is talking about. why we cannot go with the traditional way and why we should move to digital. See, it is not that we cannot go. Absolutely, we are going, we will be going also, Rajput. Nobody can replace one physical doctor with something. But yes, at the same point of time, somebody is staying in the remote areas. I'm talking about now preventive healthcare. Somebody is staying very remote. He or she does not have an access. If I talk about Bihar situation, the best of the best doctors are sitting in Patna. I'm talking about a very, very remote area in Muzaffarpur or maybe somewhere else, where or maybe the district of Buxar, where people did not have access to that a specialist who is sitting at PMCH. So that guy is a poor chap, not able to access to the best of the best doctors. If I want to facilitate that, he or she needs to move to here. And so many of the time, they do not have time and the effort and energy. So how do I do that? The digital mediums are basically the medium where the patient sitting at 200 kilometers away or 400 kilometers away from Patna and still able to connect. Or maybe somebody in Delhi AIMS, I am here, I'm still able to get connected. And digital health can be useful in that one. But it's given that I am not saying that it will completely replace the physical medium. No, not exactly. It can never happen. But yes, if we talk about health equity in terms of access to the best possible healthcare by all Indians, so digital health is one of the medium. And if we're talking about moving from this curative to preventive health, digital health is going to partner with us. They're going to stay with us. They're going to be a friend of us and partner with us because they will track us. They will give the reinforcements, not to forget the treatments, not to forget the follow-ups, and track us in the proper way. They're going to partner in our better health. Can we say that we have that infrastructure right now? Yes, we are still developing. We cannot say that we are already very, very in terms of like digital payment also. Few years back, we did not have platforms. With the emergence of UPI, now we are the king of digital payments across the world. Similarly, at some point of time, now ABDM, still there are so many loopholes. You can say there are so many improvements are happening with respect to ABDM. Day will come when ABDM can be a perfect platform and ABDM can be a replica of what exactly UPI in the context of digital payments. Right now, I cannot say that we have the complete infrastructure, but yes, we are going in the right direction, and the direction will definitely give us some kind of good results. And everything has to have some kind of time to buy. It does not happen. Again, behavioral shifts are there. So everything has to have some time period. So going forward, absolutely yes, digital health is being going to be widespread adoptions will be there. In case of digital consultations through app, we missed important physical examinations of patient. Yes, Harminder, absolutely yes. There are pros and cons. I'm not saying it. It is obvious. There will be some pros and cons, but yes, again, access. Access is important. It gives you access. You cannot deny that one. Even not only this, nowadays, if you look at Apollo hospitals like Apollo and Medanta, they are talking about the concept called as remote ICU. Like here, we're talking about artificial intelligence. It is one of the examples of remote ICU. AI as well as what is that? IoT. A remote ICU. I do not need to be there in the ICU for tracking of my pulse and all those kind of things. If my situations are stable, I can stay at home and remotely being tracked. Apollo and Medanta has already started this concept because ICU beds, I do not have that much of ICU beds in India. So the ICUs are now shifting to home in terms of remote ICUs. What about the developed countries like America and China? Where do India stands compared to this country in the sector? Like, yeah, absolutely. Yes. When we say, that's what exactly we said. Last year in 2024, we went to Sweden. And at the same point of time, we went to Finland to study this entire health system and how they have designed. They are, if you look at digital health, I would say when they heard about our Ayushman Bharat mission and the ABDM, they were like, a kind of an awestruck. They said it's though it's a small country, they have talked about some kind of digitalizations over there. Still then, they have not been able to do that digitalizations. And look at here, we are 140 crore people. And to reach out to that 140 crore people, it will take time. We are in a good shape. Yes, America might be having a better infrastructure right now, but look at what happened during COVID. America could not develop a digital solutions to track vaccines. Americans still use in their airports, they use that vaccination cards which were made manually take. But we were Indians, only the single country who could manage the digitally through the CoWIN app, which talked about the vaccinations and the records. So at some context, we are, yes, absolutely, given that IT capabilities we have, it is obvious that we will win this race at some point of time. At some point of time, in some sectors we are good, in some sectors we are lagging behind. And that's what exactly I said. We have some time, and with the time, with the ABTF and with the private players, with the PPP mode, now the digital health is going to take the tool and the shape. Fine then. It is important for a doctor to know about our applications are available in this industry. I did not get your question. It is important for a doctor to know what our applications are available in the industry. Yeah, it is obvious, because as a doctor, you also need two things. One is your patient's well-being and the tracking one, how easy you can do that. So you can use this electronic patient records and all. And at the same point of time, as a doctor, if you're a private doctor and if you want to do some, your clinics, your business, absolutely commercial ones, you need to expand your business. So digital mediums are one of the easiest way to expand. Yes, Kwaja, you can search me on LinkedIn. It's my name is Swapnarag Swain. So only one name is there. There is no duplication of this name. So luckily, my mother gave me this name, and there is no duplications or any social media. You can search my name. I'm there, and you can connect me over there. We can get connected. So I hope, Karishma, we are done.
Yes, sir. I believe the Q&A round is done. There are no more questions from the student side. There is a question about resources.
The resources
sites that you've used.
There is no single book on this, or maybe there is no single site. So anyways, what I'll do is that, Karishma, I will share with you a few links, right? Maybe give me a couple of days so that you can share with the participants.
Done, sir. Works for us, I believe. And with this, let's thank sir for such a deeply engaging and intellectually enriching session. The way you articulated the evolving role of digital health along with underlying behavioral dynamics has offered, I believe, our learners a nuanced and holistic understanding of the subject. Your insights have not only expanded perspectives, sir, but also highlighted how theory translates into real-world healthcare impact. Thank you so much, sir, once again for joining today.
Thank you. Thank you. I hope the objective was met.
Yes, sir. I believe the justice was done.
Okay.
Thank you so much, sir, once again, on behalf of sir.
And thanks to all the participants also for making this chat box moving frequently. Thanks a lot. I would say I did not expect, without the videos, without the interaction and the voices. Still, you made the chat box very, very interesting, and the interactions were there. So thanks a lot. Thank you. Thank you all. Have a great evening.
Thank you so much, sir. So once again, on behalf of CBOE, Center for Distance and Online Education, Lovely Professional University, I extend our sincere gratitude to Dr. Swapnarag Swain for sharing his expertise and valuable perspectives with us. Thank you so much, sir.
Thank you. Thank you. Yeah. Good night. Good night, everyone.
Good night, sir. So to all our participants, thank you for being such an attentive and engaged audience. Kudos to you. As we move forward, let us continue to explore emerging domains, adapt to evolving industries, and build capabilities that truly make a difference. I've already shared a feedback link with you all. Once again, I'm going to share this in chat box. Kindly provide your valuable feedback for this particular masterclass, special class, I should say. Wishing you all a productive and inspiring journey ahead. Thank you so much for joining us, and have a great evening. Thank you so much, everyone. The feedback link is there in the chat box.